So for the wet to dry sterile dressing, we're also going to do wound irrigation. And for this procedure, you're going to need your dressing change tray kit. It has your bag in it, so you can put your bag on the top or you can leave it out because you got a bag from maybe the Pyxis or Omnicell to bring in with you. A lot of times we just use the trash can that's there. And in your kit, you have your sterile drape, you have some 4x4 gauze, your ABD pad, there's swabs that you would use with a dry sterile dressing. You should have 2 sets of forceps, the green and the black for the packing. The green forceps are a little bit wider, makes it a little bit easier to pack your wound. There's also a safety pin, scissors, and tape, which we won't be using the safety pin or the scissors or the swabs. Okay. You will also need a measuring tape in centimeters for measuring the wound, which we will provide. Sterile cotton swab applicators, which we will also provide. If you have to do a wound culture, we have these available too. So within this process, we'll go through and I'll show you how to do a wound culture. You should have a Chuck's pad that we're going to put down under the patient to prevent the wounds drainage from getting all over the bedding. We can provide these. You will need an irrigation tray kit with your piston syringe. So we have our bottle, and during the procedure, the barrel needs to stay sterile. We can hold right here at this little lip, and then the actual inside of the plunger has to remain sterile, as well as the fluid and everything inside of there. So it all needs to remain sterile. Okay, got that. You have your Kerlix sponge that you'll need, and this is going to be used for packing the wound. You'll need a few sets of gloves. You should have some sort of alcohol-based solution, something that you can wash your hands with in between. You'll need your sterile gloves, and when you're doing dressing changes, I would recommend bringing 2 pairs in just in case you contaminate or one of the gloves tears. And what else? Oh, your sterile solution. This, we would want to look for the expiration date, make sure it's not expired, and make sure it's the solution that we would use for whatever is ordered for your patient. So it might be sterile water, might be normal saline, it could be something called Dakin solution. You find that in your order. So those essentially are the supplies that you'll need for wet to dry dressing with a wound culture and irrigation. For the start of your procedure, you always look at your orders. You remember to do hand hygiene throughout. And before you even go to do your dressing change, you want to assess your patient for pain. So you would go in, you could ask Mr. Y if he needs anything for pain, what's your pain level? And he says his pain level is a 7 out of 10. Okay, I'm going to get you a couple Percocet, which is our physician's order, and we're going to give that 30 to 45 minutes prior to doing the dressing change. During that time, I can get my supplies, and then I can get ready to go back in the room, reassess how his pain is. He says his pain is a 3 out of 10 this time, okay? So we've knocked on the door, introduced ourselves, we've looked at our orders, we get our identifiers, name and date of birth, any allergies, gives name and date of birth, says there's no allergies, and I've washed my hands, I've got my supplies all gathered. We want to make sure we lift the bed to a comfortable position. And we want to put the rail down as well so that we're not stressing our back. Okay. A good thing to do before when you're going in initially to get your pain assessment is to take a peek under the dressing to see what you need. It might not always be listed in the order or in the documentation. So you want to make sure you have all your supplies. I know that he's going to need the gauze packing, 2 4x4s, and ABD pad for his abdominal incision. Okay. get my gloves after I washed my hand. Make sure you have good lighting. And I'm going to ask Mr. Y if it's okay if I put this bag down by his side. Just expose what's necessary. Okay. All right. And we're going to gently loosen the tape on the ABD. Okay. All right, Mr. Y. And then we're going to pull one layer at a time out of the view of the patient. And I'm looking for color, odor, consistency, and amount. So think coca. And I don't see anything there. And then I'm going to go to the next layer, color, odor, consistency, and amount. So maybe he has a little serosanguinous drainage. And then I can go in and I can get the packing, again, color, odor, consistency, amount, serosanguinous, small amount, no odor. And then we're going to look at the wound. We're not going to hover over it, but we're going to look, and I see around the wound, the peri-wound, there's some erythema, which is red, a little bit swollen, and then within the wound is granulation tissue, and that means that it's looks to be healing well. It's healing by secondary intention. Okay. Then we need to do a measurement. We always want to use centimeters, and we're not going to put it right over top of the wound. We're going to hold it over top. We're going to go length first. So we find the longest part of the wound. And we're always doing this in centimeters. So this is 13.5 centimeters length. We're going to find the widest part. And we are at 2.5 centimeters in width. And we're going to open our sterile package for our sterile swab. And that's going to go into the wound at the deepest part. Like it. All right. Okay, bring it down flush, and then hold it here against our measuring stick, and we're at 3 centimeters in depth. Okay. So I've done my description, I've done the measurements for it. Now I'm going to get ready to do my irrigation. So I'm going to take these off and wash my hands, just because I could have gotten something on there. Okay. I'll get this set up. As we're doing sterile packaging, we're always going to pull away from us. But I can reach in and grab this. I'm going to use this as a basin for my drainage. Again, look at my expiration date, make sure it's not expired. If it's been opened, it's good for 24 hours. It's sterile water as per the physician's order. I'm going to pick this up. I have the label in the palm of my hand, and I'm going to pour. And I'm going to gently put that back in without touching it. Get my gloves on, and I'm going to reposition my patient because we want things to flow by gravity. I'm going to help him turn to the side. Okay. So he's over to the side, and I'm going to put a Chuck's pad underneath to help keep the bedding and everything from getting soiled. So I'm putting the Chuck's pad there. I'm going to put my basin here. Okay. I'm going to do my wound culture really quick, and then I'm going to do my irrigation. So this would be sterile. And we do this before we cleanse it to see what kind of bacteria we've got growing in there. That stays sterile. That pops in there. This gets the patient's information tag on there with name, date of birth, MRN. And then you also want to put your name, the date, and the initials, as well as what part of the body it came from. And you'll send that down with the requisition. A lot of facilities require a second nurse to double check it, but that's not an emergency to send down right now. So now we're going to irrigate. I can hold right here. I can pull up. And I'm going to start toward the top and irrigate toward the bottom. of the wound. So along the top toward the bottom, top toward the bottom, top toward the bottom, and I'm letting it flow down into this basin. So we'll say that I did 3 passes. The order says irrigate until clear. It is clear. So I am done with that part. Okay, so then I can get rid of my basin and I can get rid of my chucks pad in the garbage. And I can assist the patient back to a flat position. Okay, and then getting rid of these gloves, and we're going to put new gloves on, your sterile gloves, after we set everything up. Okay, so alright, so I like to put my Curlex, which is going to be for packing, over here, and I like to wet it with the saline and actually get it wet. It's going to help you with your packing process. And then I'm going to get my kit ready to go here. So remember, we're peeling away. Get my sterile drape. I have 1-inch border to manipulate. Set it out. Then I'm going to come and put my gloves on. You can do it on the end of the bed here. You can come over on the other side, is fine. Just as long as you can still see your field. So we open our wrapper. We have a 1-inch border. You can do non-dominant or dominant first, whichever feels more natural. I'll see if this is flapping. You gotta get it to stay straight, because you can't just take your hands and press down in the middle. So I'm going to tuck my 4 fingers in with my thumb hitchhiking, put my thumb in, and pull down. And then I'm going to leave my cuff just like that. And I'm going to come in with my 4 fingers, taking 4 fingers in, tuck my thumb, and pull up, and I'm sterile. Hands have to be above the waist. Sterile field needs to be above the waist. And I'm going to set out my supplies, and I just like to set them out so that I know which way I need to go. So I'm putting my 4x4s there, my ABD pad there. I don't need my swabs. I'm going to get my forceps, and tape doesn't have to be sterile, but I'll just set it over there. Okay. So now I can't turn my back to my sterile field, and I like to just plant my foot. You have to have it in your peripheral vision at all times. Okay. So I'm going to fluff this out a little bit. And I'm going to kind of snake it, almost like a rope. And even though I'm right-handed, I'm over here on the left side, but I like to be able to pack going down this way. So you don't want to touch the outside of the wound, and you don't want to touch down in the inside of the wound. And if the packing touches outside of the wound, you would have to get a new piece and start over. Okay, so that's packed. Now I can do a 4x4, pinch in the middle again for my other 4x4, and my ABD with the blue line up. Sterile's done. And I'm going to do my 3 pieces of tape. Tape one across the top, one across the middle, and one across the bottom. And then don't ever write on your patient. You'll get a separate piece of tape. Put your initials, the date, and the time. What is it? 11:30. Okay. And then you just get everything cleaned up. And the patient covered, comfortable position, all of your safety things in order, see if they need anything, how's their pain, do they need assistance to the restroom, side rails up, call light within reach.